Hello, my name is Sarah. I'm a pelvic health physiotherapist here in the Adelaide Hills, and as recording this video, I currently work in Mount Barker and Stirling at the Adelaide Hills O&G clinic. I'm a pelvic health physiotherapist who sees all genders, and I'm really passionate about what I do. I see people who have bladder concerns, and this might be people who leak with coughing, laughing, sneezing. I see people who have bladder urgency, and they may or may not leak from this. They may experience urgency as they drive home from doing the shopping and put the key in the front door. They may have urgency when they hear the shower running or they're doing the washing up. They may have urgency when they're walking down the cold aisle of the supermarket. I see people who have bowel issues, and this may be fecal urgency. They may have difficulty doing a poo. They may have trouble controlling their wind or even controlling their poo. I see people who have pelvic organ prolapse issues. So that's where an organ may be descending down through the vagina. It may feel for some like there's a bulge down in the vagina. It may feel like a tampon's falling out. Some people may experience back pain. I also support pelvic organ support pessaries, so a device that goes inside the vagina to help hold up that organ. I see people, or women, who are pregnant or postnatal, and that might be for aches and pains they're experiencing. It might be for bladder or bowel issues, for prolapse issues. And an area that I'm really passionate about is labour and birth preparation, and looking at the non-pharmacological management strategies for this. I see people before and after surgery for anything of this region. And this might be gynae surgery, it might be prostate surgery, it might be bladder or bowel surgery. And I see people who have pelvic pain. So that can be wide and varied. And I'm also a member of the Adelaide Pelvic Pain Network. Patients often ask why I became a pelvic health physiotherapist and why I enjoy it. I actually fell into this area quite early on into my career and have just found it so rewarding. I feel like it's such a privilege to hear people's stories and for them to share things that they may not have ever actually shared with other people before. I love being able to help people improve their quality of life with these matters. And I also really enjoy the fact that there's such strong evidence supporting what we do. And I really enjoy working alongside many other health professionals to help you improve. A little bit about me. I seem to love studying. I've done a Bachelor of Physiotherapy here in South Australia. I then went on to do a Master's in Musculoskeletal and Sports here, and then went to do a professional certificate in, postgraduate certificate, in pelvic floor physiotherapy in Melbourne. And I've done a graduate certificate here in pelvic organ prolapse, and I've also done some study into clinical hypnotherapy here with the Society of Hypnotherapy. I have worked in many different areas. I have worked at many of the different hospitals here in South Australia, at Flinders Medical Centre, at the Queen Elizabeth Hospital and the Women's and Children's Hospital, and I've also worked in a variety of private practices, and I've tutored students through several of the universities here in South Australia. I'm originally a Tassie girl and came here to study and then fell in love. I have a young family here in the Adelaide Hills, and I really love exploring the outdoors. I love cooking, I love reading, and love travelling. Thank you for watching my physio essay bio video. I hope that if you have any pelvic health concerns, that this little video may give you some confidence and encouragement to seek help. You may be surprised by how much you can do to improve. Take care.